Good evening. We are getting a better sense tonight of the financial costs to the City of Toronto during the COVID-19 shutdown. And according to our mayor, the figure is in the billions. A drop in revenue and increased expenses is hitting the city hard. And without a bailout from upper levels of government, the city could face some tough choices. Philip Lee-Shannock explains.
The COVID-19 pandemic is costing the city government $65 million a week, most of that being in the lost revenue.
Mayor John Tory says the City of Toronto's books are taking a major hit from such things as deferred property tax, utility bills, and land transfer tax. An 80% drop in TTC ridership alone is costing the city more than $20 million a week. The costs of COVID-19 are adding up fast. Estimates are that a 3-month lockdown and 6-month recovery will cost $1.5 billion by year's end. And that's the best case scenario. If the lockdown goes on longer, the city could be in for a $2.76 billion hole. Tory says the city is working on a plan that will maintain services without large tax increases. And that's worrying permanent city workers that layoffs could be coming. City workers' unions say they can't see how there could be any more cuts. Already, 5,400 seasonal positions are gone as rec programs have been canceled.
And so,
Tory says everything is on the table since, due to legislative constraints on how municipal governments are funded, losses in the hundreds of millions of dollars would be nearly impossible for the city to recover because it cannot legally go into debt to pay for operating expenses.
while we are scouring the city government for savings while still maintaining all the essential and critical services that people rely on in the city and that we're providing today through the pandemic, we will need help from the other levels of government.
Premier Doug Ford says he's heard the pleas of mayors across the province.
I know they're struggling. All levels of government right now are struggling financially based on this COVID-19. And we're going to do whatever it takes. I've said from day one, I won't spare a penny.
The federal government says it's also heard from the provinces and city mayors and is aware of the need for urgent financial support, but hasn't announced any help yet. Philip Lee-Shannock, CBC News, Toronto.
1 month since Ontario issued a state of emergency, we want to give you a snapshot of where the province stands tonight in the battle against COVID-19. Health officials reported 564 new cases of the disease today. That is the highest single-day jump in cases so far. Ontario has a total of 9,525 cases of COVID-19. 22 new deaths have also been reported. Ontario now has a total of 523 deaths, according to data CBC News has collected from regional public health units. Just under 9,000 samples have been tested over the past 24 hours. That puts the province at the testing level officials had earlier stated was their target. 1 in 10 COVID-19 tests in the province are now taking place in drive-through facilities. The sites are giving patients rapid access to testing, while healthcare workers are spending hours in freezing temperatures to keep them running. Lauren Pelly spent an afternoon inside one Etobicoke testing tent to see what the process is really like.
Well, it's very challenging. It's certainly, you can see today the wind is really strong. So there are winter-like conditions, and your fingers are cold, so it's hard to do all the delicate work.
So we're seeing everybody from young children to the elderly coming through. And when we first opened up, we saw people with very mild symptoms, not too sick. Of the last couple of days, we've seen a lot more people coming through. We went from about 40 patients a day to about 100 patients seeing a day. And now we're seeing more severe symptoms presenting at the assessment centers. So a lot of people are presenting with more shortness of breath, more cough, more fevers.
It's going to be uncomfortable. I'm going to put a swab, it's going to go in your nose, it's going to go in deep.
It is considered a bit of an invasive test, so basically it involves putting a wired Q-tip type applicator into the back of your nose and into the what we call the nasopharynx, and we get a good sample from there.
That's it. Okay, thank you so much. Then once we get the sample, we put it into here, and then this goes into one bag with the patient's name and the time. We clean this bag off, and then we double bag it into another bag, and then we put it into our transport bag, which is picked up by the lab.
How long does that piece actually take?
Seconds. Yeah, it's fast. The longest procedure here is probably going from the screening tent to this tent here, which is the swabbing tent.
You're just going to cover your mouth. You're going to tilt your head back. And you're going to keep your mouth closed, okay?
You know, a lot of us, come from different areas, so we don't know each other. So, it's different when you're working with your team members. There's a bit of familiarity with everybody, but we've all had to come from different areas, and we meet and we develop, and it changes every day. Today we're using laundry clips to hold things down because, we're just trying to make do with what we have.
And it's much faster than going through the emergency department. If you don't have the severe symptoms of shortness of breath, this is the kind of facility that you should be accessing. The more people you test, the better the contact tracing, the better the follow-up, and you can actually mitigate the outbreak.
We have a list of all the drive-through testing sites in the province on our website. To find out if there's one near you, head to cbc.ca/Toronto.
It happened so fast that until now I can't even digest it too. She literally gave her life for that place. In the end, she really gave her life.
COVID-19 claims the life of another healthcare worker. This man's wife died after contracting the disease at a Toronto long care home. Christine Mandagarian is the second Ontario healthcare worker to die from COVID-19. Tonight, she's being remembered as a dedicated caregiver, a longtime employee of the Altamont Care community in Scarborough. Lisa Shing joins us live now with more on this. And Lisa, those who knew and worked with her are understandably devastated by her loss.
They are, Dwight, and they're also worried and torn about being concerned for the safety of the residents as well as their own safety. As you heard there, Christine's husband is still trying to come to terms with his grief, and all of this as the community came together this morning. A show of support for healthcare workers at Altamont Care Community.
We love them and we support them, and we've got their back.
They feel happy because we're appreciating them.
Yeah. Just to show our support for everyone and all the hard work they're doing and just the tragic situation that they're going through.
Staff and residents at Altamont are now mourning one of their own. Christine Mandagarian was a personal support worker there for more than 30 years. We spoke with her husband over the phone.
My wife died all by herself in a cold room. She died all by herself, all alone with kids not next to her.
With hospitals closed to visitors, Mandagarian's husband Parvez nor her children could be with her when she died. He says he's shocked at just how fast COVID-19 took his wife. The couple's daughter drove her to the hospital on Monday because she was having difficulty breathing. By Wednesday, she was dead.
She was a very nice, happy-go-lucky person. She was a very hard-working woman. She was a very dedicated worker. She worked all her life at that place. She literally gave her life for that place. In the end, she really gave her life.
Today, her co-worker said the mood was heavy as they came and went for their shifts.
It's very somber. We miss our co-worker. We miss all our residents that have passed.
According to the union representing the workers at Altamont, many of them are scared to go in.
They are grieving. They're sad, they're angry, they're frustrated, they've lost all confidence in their employer.
Sienna Senior Living, which owns Altamont, says the team has implemented all precautions and directives, including active screening, enhanced cleaning, and isolation protocols. And Altamont has always had the correct PPE and has used it in accordance with public health and provincial directives. For Parvez Mandagarian, who is still trying to come to terms with his wife's death, those measures weren't good enough.
I'm just now in the house. I can't go anywhere. I can't do anything. I can't even see my wife is going to be cremated in another hour and a half. 12 o'clock noon, she'll be cremated, and I'm not even there to see my wife. I never saw my wife dying, or I never saw my wife. You know what? It's a horrible thing. You know what?
Now, we learned that his wife was cremated at noon today, and we spoke with her husband before that. Now, the union representing these workers who work at the home are also calling on the province to take over managing long-term care homes in Ontario, like British Columbia and Quebec has done. Here's what the Minister of Long-Term Care had to say about that today.
Other provinces do things differently than Ontario in terms of who operates homes. In Ontario, the Ministry of Long-Term Care does not operate homes, but we will assist where other companies need to come in and provide resources and support for struggling homes.
Now, I asked the province as well why it didn't implement some of these measures to protect workers sooner, like mandatory masking. The province told me that it followed public health guidelines. Dwight?
Sad story. Thank you for that, Lisa. Now, the toll this pandemic is taking on healthcare workers was the focus of a media conference today by frontline workers.
Healthcare workers in Ontario continue to be infected at a dangerously high rate. We continue to believe that this is a result of a complete lack of access to personal protective equipment on the front lines.
Today's conference included a moment of silence for the first GTA healthcare worker to die from COVID-19 complications. The 58-year-old worked at Brampton Civic Hospital. He passed away last week. The press conference was organized by the Canadian Union of Public Employees. Just under 1,000 healthcare workers have tested positive for COVID-19 across Canada, but CUPE believes more testing would show that number to be much higher. In Ontario, healthcare staff make up about 11% of all reported COVID-19 cases. Long-term care homes are being hit hard by COVID-19 with outbreaks happening right across our province. Eatonville Care Centre in Etobicoke has had a massive outbreak with at least 79 confirmed cases of COVID-19 and 31 deaths. We spoke to a man whose father was the first coronavirus-related death at Eatonville.
We found out that he had coronavirus on the eve of his death. And my sister was also with him at that time and exposed to the virus, and we didn't have the test results available. So both of us basically risked visiting our father in palliative care in order to see him before he passed away. She had some symptoms, and today she got tested, and she'll know in 3 to 5 days whether she's okay. She was contacted by public health after my father's death. I was not contacted by public health. I think that the other residents' families should have been notified immediately after my father was diagnosed. It's been difficult because we haven't been able to keep in touch with each other physically, but we're there, we're there on the telephone every day. We're supporting each other the best we can, and we're hoping to have a ceremony of life, celebration after Corona is defeated. We're in the fight for our life, and I believe that the only way we're going to defeat Corona is through cooperation, honesty, transparency, and compassion. We need to stick together. We need to be honest with each other. We need to stop the blaming and start creating solutions and working together and providing compassion to defeat Corona.
We are learning tonight the province was warned of serious problems in the long-term care system years before COVID-19. Those warnings came from a 2018 public inquiry looking into the safety and care of residents in these homes. An inquiry stemming from the murders committed by Elizabeth Wetlaufer. John Lancaster has more.
Daniel Silcock says watching COVID-19 tear through care facilities takes a personal toll.
If we had our priorities straight, we would have protected these poor souls a long time ago. We should have had the systems in place.
His 84-year-old father, James, was one of 8 people killed by nurse Elizabeth Wetlaufer. Wetlaufer also maimed 8 others, all with massive doses of insulin to satisfy what she called her red surge to kill. A 2018 public inquiry looking into her crimes revealed she manipulated shortcomings in the system to carry out her attacks at multiple homes and facilities she worked at. Her crimes went undetected for more than a decade until she finally confessed. She's now serving a life sentence.
I think there's a lot of similarities.
Advocate Jane Meadas says while Wetlaufer was a human threat, the COVID-19 is the viral threat that exposes gaps in the long-term care system that still exist. She points to numerous lessons learned from the Wetlaufer inquiry. It urged the province to increase funding for care homes, increase staff training, and also warned the province about care staff working in multiple locations. Some do that to make ends meet, but it's now believed they've also brought COVID-19 with them.
all of those things can be looked at and said, hey, these were a problem before, and it may have increased the spread of COVID within the homes.
It was only this week that the province ordered a partial ban of care staff working in multiple locations. As for Daniel Silcox, he hoped his father's death and the inquiry would have sparked big changes sooner. He says that may now tragically be up to others.
My heart now goes out to the poor people that have lost their lives, the poor people that have lost their relatives, their husbands, their wives, their fathers, their mothers. It's going to be their legacy. And my heart absolutely goes out to them. I'm brokenhearted about it.
John Lancaster, CBC News, Toronto.
The Pinecrest Nursing Home in Bobcaygeon saw one of the first outbreaks of COVID-19 here in Ontario. 29 of the 65 residents of the facility died. But after days without a death, there was a chance for a little bit of joy today. This is 91-year-old Lorraine Button going for a walk outside for the first time since the outbreak took over Pinecrest. It's the first walk of its kind in weeks, according to the facility, and clearly staff there are more than happy for the moment to celebrate. Lorraine herself tested positive for COVID-19 on April 1st, but Pinecrest says she is now doing well and was more than ready to resume her daily walks. While school in the province is out for the foreseeable future, the government is partnering up with companies to make e-learning more accessible.
We launched the most ambitious learning plan in this country, and I know that we have to bridge the gap for those kids that may not have the tools to learn. It isn't their fault, and as government, as the Premier made clear, we've got their back. So from internet access to tablets and iPads, we recognize these are important tools to learn.
Apple and Rogers will provide iPads and tablets for low-income families so that students can continue learning online throughout this pandemic. Those packages will also include internet connectivity. The province will also provide free childcare to more people, including for those who work at homeless shelters, Canada Post, and CBSA employees. The province says they will continue to monitor the situation and decide when schools can safely reopen, but are developing plans to continue remote learning until the end of the school year. A special appreciation salute in Scarborough today to help thank frontline workers for all they are doing during this pandemic.
As you can see and hear, extremely heartwarming and emotional. You can see our staff are lined up outside and inside up in our windows as well. So it's a pretty exciting time, a great way to inspire the team for the hard work that they're doing every day.
Toronto Fire, police and paramedics took part in the salute, cheering and blasting sirens from their vehicles. Members of the community also came together to thank healthcare workers at Scarborough Health Network by making signs and driving by the hospital to show their support. It's so important that we continue to do that, Colette.
Yeah, thanks, Dwight. Yeah, I absolutely love these stories. It's so nice to see them. And obviously our frontline hero stories too. You got to hang in there for that one coming up later in the show. But I want to show you what's going on with our temperatures right now. And you can see the difference between where we have 3 degrees, Hamilton 1, 2 in St. Catharines. I know it's not a lot cooler, but it illustrates where we have this line of where the system to the south is having an impact with some flurries and light snow that's passing through. At times it's a little bit of a mix. You can see those winds coming in. All right, from a southerly direction, some cases it's southeast, in some cases southwest, but this is the center of this system is in the U.S., but it is just kind of pushing through and giving us that bit of light precipitation. Now, some of these flurries quite likely making their way, although somewhat scattered, but into the GTA in the evening hours, but we're really just going to be clipped because the bulk of this is still pushing over towards the Golden Horseshoe and still having an impact back in southwestern Ontario as well, where they're looking at 5 to 6 centimeters before it's over with later on this evening, whereas it's more of a dusting to a couple of centimeters here. We're talking about through St. Catharines and Niagara Falls and even around towards Hamilton there. So some of the flurries coming our way, that mixing moves off, the light snow all moves off, and then the clouds are actually going to back off as well overnight tonight. With that clearing, it sets us up for sun on Saturday. Now, We will see some clouds at times kind of mixing in there, especially a little later in the day, but it is going to be a nice day, and also we're going to find those temperatures finally going back to where they should be for this time of year. Later in the weekend, we're going to talk about these showers. We'll do that later in the show as well, but there you go with our overnight low -1, Dwight, feeling like -5, and hey, 10 degrees for our high tomorrow. Double digits.
Might be out there in the garden or on that balcony garden. We'll see. Thank you, Colette.
You're welcome.
The weather update is brought to you by Trane, the most reliable heating and cooling brand. We test, so it runs. Take advantage of special offers now. It's hard to stop a train.
Amid allegations of underreporting, China sharply changed its official death toll for the coronavirus today by more than 1,000. What the Chinese government has to say about that, coming up next. China has sharply revised its official death toll from COVID-19, adding nearly 1,300 to the national count. That's an increase of 40%, which seems to confirm widespread suspicions of underreporting by the government. Today, China also revealed some bleak economic news. Freelancer reporter Patrick Falk has more now from Beijing.
The The decision to revise the total number of deaths comes after authorities said that medics had been overwhelmed and there'd been a lack of testing capacity, particularly at the beginning of the outbreak. And you have to remember that this is where the outbreak began. So in many ways, China was dealing with the unknown, and authorities might argue that this, in fact, is an example of China being open and transparent about some inaccuracies and have tried to correct that. And the figures are substantial. 1,300 might not sound like an awful lot in the grand scheme of things when you look at the total number of deaths in countries like the US and Italy. But if you put it in China's context, it raises the national total by about 40% and raises the total for Hubei as well by 50%. And of course, a lot of China's critics are going to be saying, well, what other data that's coming out of the country is inaccurate? The other headline story today, of course, was China releasing Q1 GDP figures. It shrank by 6.8%, the first time that the economy has shrank since GDP records, quarterly GDP records began in 1992. And it spells out just what challenge lies ahead for authorities to revive the economy. There was some mixed data otherwise as well. Industrial output was down 1.1%, which was actually better than expected. But of course, there are concerns about demand moving forward as the rest of the world grapples with the coronavirus. And also retail sales were softer than a lot of people had expected. And that's an indication that consumer demand may continue to be weak in the weeks and months to come. Patrick Falk, CBC News, Beijing.
Don't understand why they can't offer refunds.
No money back guarantee. Have you been left holding tickets for postponed concerts or events? Why ticket vendors say they have a right to keep your cash. Next. The federal government outlined new assistance measures specifically for the oil and gas sector. The goal is to create immediate jobs in an industry battered by slow demand due to the pandemic and bruised by tumbling oil prices. Julie Van Duzen has the story for us.
Probably nowhere in the country are Canadians suffering more economically than Alberta. The province's energy sector hit with declining prices for years. A recent oil price war between Saudi Arabia and Russia, and now their economy slammed by COVID-19.
Both the devastating effects of the pandemic and the price war driven by foreign interests are a challenge.
A double whammy, as their Premier Jason Kenney has been saying. Now, Ottawa will spend $1.7 billion to clean up some of the tens of thousands of orphaned and inactive oil wells in Alberta, Saskatchewan, and BC. 5,200 jobs will be created in Alberta alone.
Our goal is to create immediate jobs in these provinces while helping companies avoid bankruptcy and supporting our environmental targets.
Premier Jason Kenney tweeted his thanks, saying this is critical to getting thousands of people in the energy sector back to work immediately. Conservative leader Andrew Scheer says the government has been slow to step in and help the sector, but he supports the plan to clean up orphaned oil wells.
We believe this will achieve two purposes. One is it employs many people, and it has a very positive impact on the environment.
Also, the government will set up a $750 million fund to help the industry meet new regulations to lower methane emissions. $75 million of the fund will go to help the offshore industry reduce emissions in Newfoundland and Labrador.
There's no way we're going to get to net zero without our oil-producing provinces and without the oil and gas sector.
Almost $2.5 billion for the hard-hit oil and gas industries. But consider that Jason Kenney says the energy sector needs up to $30 billion. So Ottawa knows only too well that more help is needed, and needed soon. Julie Van Duzen, CBC News, Ottawa.
As many Canadians deal with the painful reality of job loss and uncertainty because of the pandemic, new data from Stats Canada is offering insights into how others are adapting to a new way of working. More than 4.5 million Canadians who don't usually work from home did so during late March. Nearly 60% of those who switched to working from home had a bachelor's or a higher degree. The report suggests that this option is more accessible for those employed in professional or managerial occupations. With bars and restaurants closed due to the pandemic, GTA breweries have lost one of their main streams of revenue. To stay afloat, more than 20 breweries in Toronto started offering home delivery, while others have had to get even more creative. Kelly Ewan shows us how.
It's the new normal for Doug Appledorn, contactless home delivery.
This is the only way we can sell our beer right now.
Appledorn co-owns People's Pint, a small craft brewery in the Junction. He says since brewers aren't allowed to charge for delivery, they've been doing it for free with a $50 purchase. And they're swamped with orders, but it's still less than half of what they made when bars were open.
At this point, it's not about making money, it's just about staying in business.
They've also had to get creative, partnering with local companies Delight Chocolate and the Junction Fromagerie.
So we're doing what are called sommelier 6-packs. So we've got 6 beers, 2 cheeses, and chocolate. And they've been wildly popular.
Great Lakes Brewery in Etobicoke has had to adapt fast.
We did it in 3 days. We had our online store up and running.
Until the pandemic, they had never sold beer online. Now they're bottling around the clock and delivering 7 days a week across the GTA. Streamlining that hasn't been easy.
We have to factor in gas, time, routing, picking. It's a lot more complicated than just here's the order, go send it to our distributors and have them do all the work. We're making money with the online sales, but beer tourism is a huge, crucial thing in craft breweries.
And with summer approaching, it'll be a big loss.
The average brewer is probably down north of 70% in their sales.
Jeff Dornan is chair of the Ontario Craft Brewers Association. He and his brother own All or Nothing Brewhouse in Oshawa. Instead of beer, they've switched to making sanitizer 24/7 for local hospitals and businesses.
The demand is amazing, so we're just trying to get as much put out as possible.
Still, they look forward to going back to the way things were.
The goal is never to make sanitizer again. We want to get back to making beer.
For now, People's Pint has also started offering pickup once a week. As to whether they'll keep doing home deliveries when the pandemic is over, Great Lakes Brewery says probably not, because they're about community first, and that means bringing people here to their tap room. Kelder Yoon, CBC News, Toronto.
Now, Canadians are among millions of fans holding tickets for shows and events facing an uncertain future during the pandemic. And now, as Dave Seglins tells us, Live Nation and Ticketmaster, the world's biggest entertainment company, says it doesn't have the money to offer refunds.
Remember this? The joy, celebration before COVID-19. And now, in just days, it's all gone silent. Fans stuck with tens of millions of tickets for shows that are canceled or postponed.
We bought tickets for Justin Bieber.
Dylan Snow is a student studying the hospitality sector. He's stuck with $4,000 worth of tickets that he bought for friends for 2 shows. Ticketmaster and parent company Live Nation won't give him his money back.
They postponed the concerts with no known performance date. I mean, they're worth billions of dollars. I don't understand why they can't offer refunds.
Live Nation says handing money back isn't so simple. Cash from fans flows up into a complex pyramid to scalpers and ticket companies, then to venues, to promoters and managers, to the artists or sports teams.
People say...
But this former Live Nation executive says the global shutdown has exposed a major problem.
Responsible promoters should have enough access to cash to pay for their operations without utilizing the advanced ticket sales, which should be held in a consumer escrow account.
Live Nation and Ticketmaster are a global powerhouse. In 46 countries, they own 273 venues. They manage 500 major artists, and last year took in $9.4 billion in concert revenue, plus another $1.5 billion in ticket fees.
They have institutionally gambled that most of the time, most events will take place.
Live Nation, like many companies, is in crisis and is asking fans for patience. While they have over $2 billion in cash reserves, right now they're only giving refunds to shows that are outright canceled. But 90% are technically postponed, yet to be rescheduled, leaving fans out of pocket until COVID-19 lifts. Dave Seglin, CBC News, Toronto.
Garden allotments in public parks can be a great way to enjoy time outdoors while also growing fresh food. That's why some are puzzled over Toronto's decision to close them down during the pandemic. Nellie Kalada has that story.
Okay, there you go, perfect.
This time of year, Tony Nataliazzo would normally start getting ready to grow his own food and donate extra to the local food bank. It's even more important now, he says, while we're in the midst of a pandemic.
This situation can last for at least another 2 or 3 months. And here we have an opportunity to grow our own food and actually add to the food supply.
Last month, all 80 allotments located in public parks across the city were ordered closed. Nataliazzo says officials may have rushed to close the allotments. With wide paths, he says gardeners can keep more than 2 meters apart.
Access is only available to the permit holders with a key. There's no concern about the public at large there. It's only the concern of the users of the garden, and we're all responsible people. We all know each other.
And he says there's the added benefits of going outside for those who may not have a backyard.
The gardens allow us to have a connection with nature. Forget about the coronavirus and just enjoy the outdoor, do some physical work.
Still, the city says while delaying the growing season may be frustrating, it could help get things back to normal more quickly.
That is the rationale. It is to limit the number of people who are out and the number of opportunities that people would have to be out to stay home. That is the message that we've been hearing over and over again.
Nataliazzo is hoping officials will reconsider. He's written his city councillor and local MPP. Natalie Kalada, CBC News, Toronto.
Call out with the warmer temps this weekend. People will be itching to get out into the gardens.
Yes, they will be, and it's going to be difficult to hold you back. You've really got to make sure you do your physical distancing if you are going to be going out. But when we've had so many days of stringing them in the row where temperatures have been on the cool side, I know it's going to be so tempting. Milder tomorrow and with some sunshine. So just practice what we need to. And I want to show you these current temperatures because they tell the story of what's happening with the system that's still, it's a storm system that's more to the south of us in terms of the center of it, but it's just kind of having an impact as it skims by. So areas from London, Windsor, over towards St. Catharines, 1 to 2 degrees. And then it was a little bit milder earlier. We were up to about 5 degrees around the GTA because not really feeling the impact as much, at least not yet. But let me show you what's going to be happening. We know there's going to be a warm up and some sun for Saturday. Now Sunday showers moving in, but still mild temperatures, so not so bad. And then it does cool down a little bit at the beginning of next week. Nothing too terrible, but that does happen. So this is what I'm talking about. It's having much more of an impact down towards Virginia, West Virginia, Kentucky, through those regions, but a little bit of light snow, and at times it's kind of mixing through here, so sort of hard for it to accumulate, and anything that does is going to melt with those temperatures tomorrow. But I want you to see something here. So this is the live radar, the last image being kind of what's going on right now, and see how this is tracking like this, coming very close to the north shore of Lake Ontario. Now watch, I'm going to push forward into the model where the model's picking up at 7 p.m. So this, I think, is a little too far south from what we're seeing, and you can understand why I'm saying that. So I think we may see some little kind of mixing of flurries coming, pushing in past Hamilton and getting in there towards Mississauga and coming towards the city. Not much, but just again, getting kind of a little bit of an influence from this one before it pulls away. It will be pulling away overnight tonight, though, and as high pressure builds in, that's where we're going to see these clearing skies. And then that looks good for part of the day Saturday. Sunday, though, it starts off nice, but it doesn't last very long because those clouds will move in, and those showers will certainly be on the doorstep too through much of the day, it looks like, although somewhat scattered early on. Overnight tonight, -1 to -2 for your lows, a little milder in St. Catharines because the clouds hold on a little longer. 10 to 11 for our highs tomorrow. Sunday, I know, yes, some showers, but look at the temperatures still hanging in there. Tuesday looks a little nasty, Dwight, but other than that, it's not looking too bad into next week.
It is good for the garden, though.
It is good for the garden.
Thanks,
That's why I
Colette.
love working with you. You just always find that
Bright
positive
side.
note.
Thank you, Colette.
You're welcome.
As the COVID crisis continues, many engaged couples are scrambling to either postpone or cancel their weddings. Some are dealing with pretty difficult negotiations with vendors who want to play hardball. But as Asha Tomlinson shows us, one Toronto couple fought back and it paid off.
It was the perfect proposal at the train station where their romance began. And after 2 years of planning, Mandy DeWong and Jonathan Pham were excited for their dream summer wedding in July at the Manor in King, Ontario. But then COVID-19 happened. With a $13,000 deposit on the line, they started stressing over what to do.
It's been pretty difficult for both Mandy and I as we consider postponing our wedding and canceling it.
They contacted the Manor and couldn't get a refund, so they tried to change the date to summer 2021. But were caught off guard by how much that rebooking would cost. $25,000.
I think it's a little bit unfair, and we're all in the same boat. So I wish the venue were a little bit more empathetic and understanding of the fact that we don't have $25,000 to spend.
And to make matters worse, in early March, while on vacation, Pham contracted the coronavirus.
I'm stuck here in Israel because I got coronavirus while I was traveling here for the past month. So I've actually been in quarantine for almost a month here, and that has thrown a huge wrench into our wedding planning.
He recovered quickly, and so they continued negotiating with their wedding venue while they were 9,000 kilometers apart. CBC News contacted the Manor about the couple's situation, and days later they get an email saying they'll be able to postpone their wedding to next summer with no additional fees. The venue says it's working closely with all its clients to navigate through these unprecedented times.
It's great that the couple actually reached out and got to that point. It's unfortunate that they had to be put through all of that stress to get there.
Tina Avery has been a wedding planner in Ontario for 20 years. She says Pham and DeWong are not alone. There are many engaged couples fighting for a fair deal in the wake of this coronavirus pandemic. There's even this petition making the rounds, calling on all venues to let couples cancel or postpone their wedding with no penalties.
I have recommendations that I make all the time, and at the end of the day, if you're still unhappy, I guess the next process would be to get some legal advice with regard to your contract and what's happening. But I really hope that the venues do make the realization that this is not a way to recoup money or to make more money.
This couple is just happy that fam is back home and healthy, and they're looking forward to their dream summer wedding once again. Asha Tomlinson, CBC News, Toronto.
Seems like a fair compromise. With gyms and workout studios closed, many people are figuring out how to exercise at home, and that means gym equipment is sold out. So when one Toronto trainer couldn't find the real thing, he made his own. Nelly Nanowski shares his story.
It's hard to tell, but that 77-pound barbell is homemade from concrete.
Well, so I went to a store to look for weights. The whole section was empty, like everything was gone.
Bare shelves, and online, people are price gouging. These 25-pound weights normally sell for $70. On Facebook Marketplace, they're $200. And with gyms closed, personal trainer Darcy Rajguru opted to make his own equipment.
And so I thought, what's heavy that I can use? So I went to the concrete section, and there were like 5 bags of concrete left, 66 pounds each. So $5 a piece, so it was a bargain.
He got to work using buckets to form the barbell and empty protein containers for 2 30-pound dumbbells.
I was a bit skeptical at first, not sure how that would turn out. But I guess since up to that point he was using me as a weight, I was pretty on board for the plan.
They mixed the concrete and got the wooden dowels to stay.
And I did most of this in my shower. I'm in a condo with no balcony, so it was messy. Like, concrete's pretty dusty.
A little black duct tape to stop the concrete from chipping, and the set is working out well. Darcy even inspired some of his friends to do the same.
Okay, so you're looking at Alphagettio cans. Took old soup cans, and then I took the tops of pop cans, and I just placed them to the bottom of the dowel and then poured the concrete on top of that.
She also made a skipping rope.
I made these out of the top set of markers, old permanent markers that I spray painted. This is wire from Home Hardware, again. This is electrical tape. Everything takes days to come, to be delivered, and the premium that you have to pay is crazy. So it's better to just make stuff at home.
So each of them spent about $40 to make their whole gym set. I got lucky though and spent nothing. I got my parents to dig out these 1980s beauties from the basement. And even though some of them have a little tape on them, they still work out well. Natalie Nanowski, CBC News, Toronto.
Our government has also decided to celebrate Canada Day differently this year.
So how will Canada ring in Canada Day? Details on virtual celebrations coming up next. Tomorrow at 8 p.m., CBC will be bringing you live coverage of the One World Together at Home concert. It is the first of its kind broadcast to celebrate the heroic efforts of health workers around the globe and to support the World Health Organization's efforts to fight COVID-19. Performers include Lady Gaga, Celine Dion, Shawn Mendes, Stevie Wonder, and Sam Smith. You can watch it on CBC at 8. It will also be streamed on CBC Gem, and the whole concert will be live on CBC Music and CBC Listen. Pandemic or not, Canada's July 1st anniversary show in Ottawa will go on, but the way we celebrate our 153 years is in for a major change.
Our government has also decided to celebrate Canada Day differently this year. Canada Day will be hosted virtually.
The minister says his department is now working with multiple artists to create a virtual show. The lineup will be released at a later date. After we take another short break, today's Frontline Hero, stick around for that. We will be right back. Andrea Johnson is a florist in the Beaches, and despite opening her business less than a year ago, she's finding ways to now spread joy during this pandemic. A few weeks ago, she handed out free bouquets with notes of love and positivity attached to each of them. Now, with the crisis ongoing and many weddings up in the air, Johnson is helping couples saying "I do" online to still have a beautiful ceremony.
So I've gone from having an expected income to no income for at least the next 3 months. And I've also lost a part-time job that was helping to supplement the bills that I have to pay. So it's been difficult to navigate this time as a new business owner, but it's been also equally difficult to watch couples having to change their wedding plans. Some couples have to choose to do a virtual wedding because they want a loved one to be able to witness this milestone, but time is not on their side and they are battling an illness. Other couples are making the decision for financial reasons, practicality, or there are just some of those couples who are opting for the virtual wedding because it's the times, and we all need a little bit of love right now. A lot of these couples have had to cancel their venue, their rental, and their catering. I don't think flowers need to go, and I want to donate my time free of charge to any couple who are doing do-it-yourself flowers. So they've already ordered flowers, hopefully from a local grower, to help support them during this time as well. And they just need a little bit of support in terms of designing and decorating their home for this special day. I look forward to hearing from everyone and hoping that I can spread a little bit of kindness during this difficult time.
Thank you for the love you are sending, Andrea. If you would like to share a story about a frontline hero, send us a selfie-style video explaining why they are a hero to you. Just tag us on Twitter or Instagram at CBC Toronto. Send us a message on Facebook or just email us at torontotips@cbc.ca. All right, Colette, we're going to get to the weekend weather in a second, but first, here's something to brighten your day. Of course, you remember the shot from the Raptors championship run? Well, this shot of that iconic moment was named Best Sports Photo of the Year by the World Press Photos. We knew that already anyway. It was captured by Maple Leaf staff photographer Mark Blinch. Congrats, Mark. I've got a pic of that on a T-shirt, and I wear it only on special occasions, Colette.
Oh, yeah, we all remember that moment, whether you were there or watching from home, and that's amazing for our local photographer to take that award. So big deal there. A big deal, not as, but that our temperatures are going to be warming up. I think we've been all kind of waiting for this one. Overnight tonight, -1, but 10 degrees tomorrow. We are going to see clearing overnight, and so we'll get some sunshine to start things off. Second half of the weekend, though, still mild, but I will say we are going to be seeing some showers pushing through Sunday.
Thank you, Colette. That's it for our show tonight. Thank you so much for joining us. Stay safe for the weekend, everybody. We'll see you back here on Monday.